There's a lot of information out there about sexual health. Some of it is good, a lot of it is incomplete. And when it comes to anal sex specifically, most of what people know comes from sources that either avoid the topic entirely or sensationalize it in ways that aren't actually useful. This video is going to be different. We're going to talk about this the way a doctor talks to a patient, clearly, honestly, and without judgment. By the end, you'll have a complete, accurate picture of how to protect yourself, what to watch for, and when to seek help. My name is Dr. Patricia Holloway. I'm a sexual health physician with over 18 years of clinical practice. I've worked in community health clinics, hospital settings, and private practice. I've had this conversation, the one we're having right now, thousands of times. And what I've learned over those 18 years is that the people who sit across from me aren't looking to be lectured. They're looking for real answers. That's what I'm going to give you today. Let's start at the beginning. Pause. Anal sex is practiced by people across a wide range of identities, orientations, and relationship structures. It is not exclusive to any one group. Research published in the Journal of Sexual Medicine has consistently shown that a significant portion of the adult population, both heterosexual and LGBTQ+, engages in anal sex at some point in their lives. One large national survey found that approximately 44% of men and 36% of women in the United States reported having anal sex at least once. That's not a fringe statistic. That's a substantial portion of the adult population. Pause. And yet the medical conversation around it, in terms of public health education, remains surprisingly thin. Most people piece together what they know from informal sources. Friends, the internet, partners, none of whom may have accurate information. So let's fill that gap properly. We're going to cover 4 main areas today: STI prevention, physical safety, hygiene, and knowing when to see a doctor. Each of these areas deserves real attention, and we're going to give all of them that. STI prevention. Understanding the actual risk. The first thing I want to establish is that anal sex does carry a higher STI transmission risk than many other sexual activities. That is simply a medical fact, and understanding why helps you protect yourself more effectively. The rectal lining, the tissue inside the rectum, is significantly more delicate than the tissue of the outer skin or even the vaginal lining. It's thinner, it's more permeable. It has a rich blood supply close to the surface. This means that when a pathogen, a virus or bacteria, is present, it has a much easier pathway into the body. This is especially relevant when we talk about HIV. The CDC estimates that receptive anal sex, being the receiving partner, carries an HIV transmission risk of approximately 138 per 10,000 exposures with an HIV-positive partner who is not on treatment and not using a condom. Compare that to insertive anal sex, which carries a risk of approximately 11 per 10,000 exposures. That's roughly 18 times higher risk for the receptive partner. This doesn't mean that insertive partners have no risk. They do. But the biological asymmetry here is significant and worth understanding clearly. Now, those numbers sound alarming in isolation. But here's the critical context. Every major intervention we have access to dramatically reduces that risk. And I mean dramatically. Let's talk about condoms first, because they remain one of the most effective tools we have. When used correctly and consistently, condoms reduce HIV transmission risk by approximately 63 to 70% during anal sex, according to data reviewed by the CDC and published in studies including a comprehensive meta-analysis in the journal Sexually Transmitted Infections. That reduction is substantial. Condoms also provide strong protection against gonorrhea, chlamydia, hepatitis B, and to a lesser extent herpes and HPV. Though for those last two, protection is partial because the virus can be present on skin not covered by the condom. Correct condom use matters here more than people realize. For anal sex specifically, using a condom with plenty of additional lubricant, more on that shortly, significantly reduces the chance of breakage. A dry condom under friction is far more likely to fail. The lubricant isn't optional. It's part of making the condom work properly. Beyond condoms, we now have PrEP, pre-exposure prophylaxis. This is a medication taken by HIV-negative individuals to prevent HIV acquisition. The 2 main formulations are a daily oral pill. the most well-known being Truvada, or its generic, or the newer Descovy, and a long-acting injectable called Cabenuva, given every 1 to 2 months. When taken consistently as prescribed, daily oral PrEP reduces the risk of HIV from anal sex by approximately 99%. That is not a rounding error. That is near complete protection. The injectable formulation has shown similar efficacy in clinical trials. PrEP does not protect against other STIs, which is why it works best as part of a broader prevention strategy. Not as a replacement for condoms, but as a powerful addition to them. If you are sexually active and not currently on PrEP, I would genuinely encourage you to have a conversation with a doctor or sexual health clinic about whether it makes sense for you. It's not just for people with multiple partners.
It's for anyone who wants a high level of protection.
Many insurance plans and assistance programs cover it fully, and clinics like Planned Parenthood can prescribe it. Now, let's talk about testing, because this is where I see the biggest gap between what people know they should do and what they actually do. The CDC recommends that sexually active gay and bisexual men, and others at higher risk, get tested for HIV at least once a year and every 3 to 6 months if they have multiple partners or partners of unknown status. For other STIs, similar frequency is recommended. Here's the part that's critical. Rectal gonorrhea and rectal chlamydia, infections of the rectal tissue, very frequently have no symptoms whatsoever. No discharge, no pain, no burning, nothing that would prompt you to seek care on your own. A study published in Sexually Transmitted Diseases found that the majority of rectal gonorrhea and chlamydia cases in men who have sex with men were asymptomatic. The only way to detect them is to test for them specifically. This matters for 2 reasons. First, untreated gonorrhea and chlamydia can cause serious complications over time, including increased HIV susceptibility, and in some cases, spread to other parts of the body. Second, you can transmit these infections to partners without knowing you have them. When you go for testing, make sure your provider knows you're engaging in anal sex, because rectal testing requires a separate swab. It is not included in a standard blood panel or urine test. Many people don't realize this and leave a clinic thinking they've been fully tested when they haven't. Ask specifically for rectal swab testing for gonorrhea and chlamydia. Let me also spend a moment on hepatitis B and hepatitis C. Hepatitis B is a viral infection that affects the liver and can be transmitted sexually, including through anal sex.
The good news is that there is a highly effective vaccine.
The hepatitis B vaccine is safe, widely available, and part of the standard childhood vaccination schedule, though many adults haven't received it or have incomplete series. If you're not sure whether you've been vaccinated, ask your doctor to check your immunity. A simple blood test can confirm it. Hepatitis C, historically associated with intravenous drug use, can also be transmitted sexually, and the risk is higher with anal sex, particularly if there is any blood present from tissue tears or fissures. Hepatitis C is now curable. A course of direct-acting antiviral medication clears the infection in most people. But the key is knowing you have it. Hepatitis C testing should be part of a thorough STI screening. And then there's HPV, the human papillomavirus. HPV is the most common sexually transmitted infection in the United States. The CDC estimates that virtually all sexually active people will acquire at least one strain of HPV at some point in their lives. Most HPV infections clear on their own without causing any problems. But certain strains can cause genital warts, and, importantly, certain strains are associated with anal cancer. The HPV vaccine, Gardasil 9, protects against the strains most likely to cause both genital warts and cancer. It is recommended routinely for people up to age 26 and can be discussed with a doctor for adults up to age 45. If you haven't been vaccinated and you're within that age range, it's worth having that conversation. The vaccine is most effective before exposure to HPV, but it still provides benefit for people who haven't been exposed to all the strains it covers. Physical safety. What's actually happening in your body? This section matters more than most people expect because the anatomy involved in anal sex is genuinely different from other forms of sexual activity, and understanding it helps you make decisions that protect your body. The anus and rectum were not anatomically designed for penetration in the way the vagina is. This isn't a moral statement, it's simply anatomy. The vagina has a rugated elastic lining designed to accommodate penetration and expand significantly. It also produces natural lubrication. The rectum does neither. Its lining is smooth, relatively inelastic, and produces no lubrication of its own. The anus itself is controlled by two sphincter muscles, the external sphincter, which you control voluntarily, and the internal sphincter, which operates involuntarily. The internal sphincter is not under conscious control. It contracts automatically in response to pressure or perceived intrusion.
This is why rushing causes pain. You can consciously relax your external sphincter, but the internal one needs time and the right conditions to release. Think of it this way. If you try to stretch a cold rubber band quickly, it snaps. If you warm it up and stretch it slowly, it becomes pliable and flexible without breaking. That's roughly what's happening with the sphincter complex. The muscle needs time, warmth, and relaxation to expand safely. This is why lubrication is not optional. It is genuinely essential. Without sufficient lubrication, the friction against delicate rectal tissue causes microtears. These tears, sometimes called fissures, can be small enough that you don't immediately notice them during activity, but they matter enormously for two reasons. First, they're painful during healing, often causing a sharp stinging sensation during bowel movements for days afterward. Second, they create an entry point for pathogens.
A compromised mucosal barrier is a significantly more efficient route for HIV and other STIs to enter the bloodstream. Water-based lubricants are compatible with all condom types and with silicone toys. Silicone-based lubricants are longer-lasting and particularly useful for anal sex, but they should not be used with silicone toys as they degrade the material over time. Oil-based lubricants, including coconut oil, petroleum jelly, and other common household substitutes, should not be used with latex condoms, as they cause latex to break down and dramatically increase the risk of condom failure. Use more lubricant than you think you need, and reapply. This is one area where people consistently underestimate. Going slowly is not just a comfort preference, it's a safety measure. This is especially true for people who are newer to anal sex or returning to it after a long gap. The tissue and muscle need time to adapt. Pain is your body's warning system. If something hurts sharply, that's not a signal to push through. It's a signal to stop and reassess. A little initial discomfort as muscles stretch is common and normal. Sharp pain, a burning sensation, or a feeling of pressure that doesn't ease is not normal and should not be ignored. On that note, I want to address numbing creams because they are more commonly used than people admit, and they are genuinely problematic. Products marketed as desensitizing sprays or anal relaxants work by numbing the nerve endings in the area. On the surface, that might sound helpful. In practice, it's removing the very feedback mechanism your body uses to tell you when something is wrong. Pain exists for a reason. When you numb it away, tissue damage can occur without you being aware of it until after the fact, when the numbing wears off and you're left with an injury you didn't feel happening. I strongly advise against using them. Let's also talk about objects and toys, because this is an area where emergency room physicians see entirely preventable injuries. The rectum has a unique anatomical feature. It creates negative pressure, similar to a gentle suction effect. Objects that are inserted can be drawn further inward involuntarily. This is not a rare occurrence. Emergency departments see these cases regularly, and retrieval can require sedation or surgical intervention. Any object used anally must have a flared base, a base wider than the widest point of the object that physically prevents it from being drawn fully inside. This applies to all anal toys, plugs, beads, vibrators, dildos. If a toy doesn't have a flared base, it is not designed for anal use, regardless of what it might look like. Fingers are safe because of the obvious anatomical limitation. But improvised objects, household items, objects not designed for this purpose, carry real risk. This is not an exaggeration. It's a straightforward anatomical reality. Hygiene. What's necessary and what isn't. There's a significant amount of anxiety around hygiene and anal sex, and I want to address it practically because a lot of what people do out of concern is unnecessary, and some of it is actually counterproductive. The rectum, under normal circumstances, is not full of fecal matter. Feces are stored in the sigmoid colon, further up, and move into the rectum only when the body is preparing for a bowel movement. This means that for most people, most of the time, basic hygiene, washing the external anal area thoroughly with soap and water before sex, is entirely sufficient. A shower beforehand provides reasonable cleanliness without any additional intervention required. Enemas and douching are optional. They are not medically required for anal sex to be hygienic. Many people choose to use them for personal comfort and peace of mind, and that's a completely reasonable personal choice. But I want to be clear that they are not a prerequisite, and overusing them carries its own set of problems. If you choose to douche, use plain warm water only. Commercial enema products, including those marketed as cleansing enemas, often contain additives like sodium phosphate, bisacodyl, or other compounds that irritate the rectal lining. Using them frequently strips the natural mucus lining of the rectum, disrupts the microbiome of the gut, and can cause inflammation that, ironically, makes the tissue more susceptible to infection. Repeated or aggressive douching can also affect bowel function over time. The technique matters too. Use a bulb syringe rather than a bag and nozzle setup, which delivers water under more pressure than the tissue needs. Insert gently, use a modest amount of water, allow it to be expelled naturally, and repeat once or twice until the water runs clear. That's sufficient. You do not need to rinse repeatedly or use large volumes of water.
Timing matters as well. Douching immediately before sex, within the hour, can leave residual water in the rectum that creates its own mess. Doing it 1 to 2 hours beforehand, allowing time for the bowels to settle, tends to work better for most people. Now, the issue of bacteria transfer is genuinely important and doesn't get enough attention. The bacteria naturally present in the rectum, including E. coli and other gut flora, are not harmful in their normal location, but they are absolutely harmful when introduced to the vagina, the urethra, or other body parts. This means that switching directly from anal to vaginal penetration, without changing condoms or washing thoroughly, causes bacterial transfer that can lead to bacterial vaginosis, urinary tract infections, and other infections. This applies regardless of whether there is any visible contamination. The bacteria are microscopic. Change the condom. Wash with soap and water. Don't skip this step.
It's simple and it matters. The same principle applies to hands and toys. Wash hands before and after. Clean toys with soap and water, or use toy cleaner appropriate to the material. Toys that can be fully sterilized, glass, stainless steel, certain hard plastics, can be boiled or run through a dishwasher. Silicone toys without electronic components can be boiled briefly. Check manufacturer guidance for specific materials. The key point is that toys used anally should be thoroughly cleaned before being used anywhere else on the body or with another partner. Emotional and relational dimensions. I want to spend a few minutes on something that doesn't always make it into the clinical conversation, and that's the emotional and relational context of anal sex. Anal sex requires a higher degree of trust, communication, and comfort between partners than many other sexual activities. It requires being able to say, slow down, stop, or this isn't working, without feeling embarrassed or pressured. It requires a partner who listens to those signals and responds to them. Pressure, whether overt or subtle, to engage in anal sex when you're not comfortable, not prepared, or not interested is not okay. No sexual activity should happen under coercion or pressure, and this applies to anal sex as much as anything else. If you're new to anal sex and considering trying it, take your time. There's no physical preparation that substitutes for genuine readiness and a partner who is attentive and communicative. Start slowly. Start with external stimulation only if that's more comfortable. Use fingers before anything else, with plenty of lubricant, and take your cues from how your body responds. There is no timeline to meet. If you're in a situation where anal sex has been painful or uncomfortable, that experience is worth reflecting on.
Was there sufficient lubrication? Was there time and patience? Was there pressure to continue past the point of comfort? The answers to those questions matter, and they point toward what needs to change. Having honest conversations with your doctor. This is something that comes up repeatedly in my practice. The difficulty people have discussing anal sex with their healthcare provider. They're worried about being judged. They're worried about changing how their doctor sees them. They downplay their sexual behaviors or leave out details that feel embarrassing. I understand that hesitation. But I want to be direct with you. The information you withhold from your doctor is the information that prevents them from giving you the care you actually need. If you're having anal sex and your doctor doesn't know, they may not order the right tests. They may not discuss PrEP with you. They may not check for rectal infections that have no symptoms. They may miss something that matters.
A good doctor will not judge you. A doctor whose office is a place where you feel unable to be honest is a doctor you should consider switching. Sexual health is health. It belongs in the medical conversation without apology. When you go for sexual health screening, be specific. Tell your provider what sexual practices you engage in. Tell them whether you're receptive, insertive, or both. Ask specifically for rectal swabs if appropriate. Ask about your vaccination status for hepatitis B and HPV. Ask about PrEP if you haven't already. These conversations save lives. They're worth having. When to see a doctor. Recognizing warning signs. Let's close with the practical question of when symptoms require medical attention, because this is where a lot of people either overreact or, more commonly, underreact. Some degree of soreness after anal sex, particularly if it's been a while or if it was more vigorous than usual, is normal and will resolve within a day. The anal area has a dense concentration of nerve endings, and some post-activity sensitivity is to be expected. What is not normal, and what should prompt you to seek medical care? Bleeding that persists. A very small amount of blood immediately after anal sex, particularly if there was insufficient lubrication or it was the first time, can be from a minor surface fissure. But bleeding that continues for more than a few hours, that is bright red and in more than trace amounts, or that recurs repeatedly, should be evaluated. Anal fissures can become chronic and may require treatment. Bleeding can also indicate hemorrhoidal irritation, which is common but worth assessing. And importantly, rectal bleeding can occasionally indicate something more serious that has nothing to do with sexual activity, a reason not to dismiss it. Pain lasting more than a day or two.
Post-activity soreness that persists for more than 48 hours, worsens over time, or is associated with difficulty sitting or having bowel movements should be evaluated. This can indicate a fissure, an internal injury, or an infection. Unusual discharge. Any discharge from the rectum that is unusual in color, odor, or consistency, particularly yellow, green, or bloody discharge, should be tested. This is a common presentation of rectal gonorrhea or chlamydia, though as I mentioned earlier, these infections often have no symptoms at all. The presence of discharge means you should get tested immediately. Symptoms of systemic infection. Fever, chills, significant swelling in the anal or pelvic region, or a feeling of general illness following anal sex should prompt urgent evaluation. These can indicate a more serious infection that has moved beyond the surface tissue. Any lump, growth, or change in the anal area that is new or changing.
While most such findings are benign, skin tags, hemorrhoids, minor cysts, any new growth that doesn't resolve within a few weeks deserves professional assessment, particularly given the association between HPV and anal cancer. Anal cancer is rare, but it is treatable when caught early and survivable when caught at an early stage. If you have a history of HPV infection, ask your provider whether anal pap smears or high-resolution endoscopy screening is appropriate for you. Practical summary: what to actually do. Let me pull this together into what you can actually do starting today. Use condoms and lubricant, together, every time with plenty of both. This single step reduces your risk across the board more than anything else. Get tested regularly and specifically. Know what you're being tested for and make sure rectal swabs are included if you're having anal sex. Don't assume a standard panel covers everything. Talk to a doctor about PrEP if you're at risk for HIV.
If you don't know where to start, Planned Parenthood, community health centers, and telehealth services like NERCS or QueerDoc can all help. Check your vaccination status. Hepatitis B and HPV vaccines are available, effective, and may be covered by your insurance. Go slowly, use generous lubrication, and stop if something hurts. These 3 things prevent the majority of physical injuries. Keep hygiene simple. Soap and water is usually enough. If you choose to douche, use plain water sparingly and not immediately before. Be honest with your doctor. Tell them what they need to know to take care of you properly. If your current provider makes that difficult, find one who doesn't. And finally, talk to your partners. Communication before and during sex about comfort, pace, and what you need is not awkward when it's framed as care for each other. It's what makes sex safe and good. Sexual health doesn't have to be complicated. It does have to be taken seriously.
The information in this video isn't meant to frighten you. It's meant to give you what you need to make informed decisions and take care of yourself well. You deserve accurate information. You deserve healthcare that meets you where you are. And you deserve to have this conversation without shame. If any part of what I've covered today raised questions for you, about testing, about PrEP, about something you've been experiencing, please don't sit with it. Make the appointment. Send the message to your provider. Look up a sexual health clinic in your area. The conversation you have with a doctor might be the most useful 10 minutes of your week. Take care of yourself. That's what all of this is for.